And welcome back to Boost Boerne Business here on Boerne Radio. I say welcome back because welcome back Dr. Aziz with Apex Medcare. How are you, sir?
I'm very well. Thanks for having me.
Yeah, we love having you around, Boerne. I think you told me before you got here you kind of walked around the hood.
Yep, I walked around the hood.
Soaking it all in. I want to get to something real quick. One thing I love about you is you get involved in the community, and you've got a heart for Meals on Wheels.
Yes, I do. We have an annual Apex Health Run. And this year's net proceeds, we want to donate to Meals on Wheels and Meals on Wheels in Boerne.
That's right. We run right out of the center. And again, we thank you for giving back. But thank you for just everything you do because you're keeping us healthy with Apex Medcare. So let's kind of dive into that real quick. Primary care is what we're talking about.
Yes, sir.
We need to take care of ourselves, and you do it well.
Yeah. I mean, we're Apex Med. We call it 360 care. We see patients in the hospital and the rehabs and in the clinic.
Yeah.
And the clinic, it's a full-service clinic. We have a full-service lab, imaging, very affable providers. We want to greet you with a smile.
That's what you're doing. I was just going to say, you smile the whole time we've been talking here. I mean, there's a culture that you've created, which is a difference nowadays, you know?
Oh, yeah. I mean, part of the culture is the 3 A's of Apex.
What does that mean?
And I mean, it's the first A, and it goes in this order, is affability. Mm-hmm. And then the second A is availability. You want your provider to be available.
Let's start over. Go over that first one again and dig a little deeper.
So affability is greeting with a smile. Mm-hmm. It's being kind, approachable.
Yeah.
And I think when someone walks in a clinic, yeah, there's wait times that they talk about. We have short wait times, but I think one of the best experiences is if you're treated affably, with kindness.
That's part of the care right there.
Yeah, and of course you want your providers to be available, and you want your providers to have ability. That's the third A, which they should know what they're doing and treat you appropriately.
Yeah.
And I think we have all 3 A's of success.
Well, AAA rating, not a bad thing to have.
Yeah, that's good.
Again, in getting to know you, you're a fan of great music too. A lot of music we play here on Boerne Radio. So you got this inspirational vibe about you as well.
Oh, yeah.
Greatest song ever. What is it?
A Sky Full of Stars by Coldplay.
Oh, that's a good one.
Can I change it?
You may.
The greatest song ever?
Yeah.
U2's It's a Beautiful Day.
There, now we're talking.
Yeah. I mean, I could listen to that song on repeat.
Just wake up with that.
Actually, I do listen to that song on repeat.
Well, you have great taste in music. You have a great culture, like I said, you're developing. But we need to be healthier.
Yeah, we do. And part of that is just seeing a provider on a regular basis.
What does regular mean?
Regular means annually at minimum, particularly to get your lab work, your blood pressure checked, and your vitals, and to prevent things from happening.
Okay.
And a lot of times just seeing a provider and asking questions will spark more questions. The doctor can go and ask you how you're doing. And it's not only health physically, though. It's also mental health, too. I mean, some of the questions that we ask, it's a survey called the PHQ-9 for mental health. And it just asks us simple questions, and it leads to things, and it helps us help the patient.
Good. Can you give me an example of one maybe that might flip a rock?
Yeah. Flip a rock. Are you feeling depressed?
That's a good question.
Now, a lot of people don't get asked that, and then they stop, they think, they're like, maybe I am. And then we can dive deep into that, and what does that mean?
Yeah. And
as a provider, we could do our best to help our patients.
All right. Any advice on a solution to that? Besides medication, right?
Yeah. Besides medication, exercise and diet.
Wow.
Yeah, it's that simple.
Yeah.
I mean, I use exercise as a stress relief. And we were talking earlier that I run on a regular basis.
Yeah.
In the San Antonio Marathon and plan on doing the Austin this weekend.
Oh my gosh.
Yeah. And people tell me, oh, you just love running. You're a running maniac. I was like, no, actually it's for mental health. It makes me feel better. I'm a happier person. Guess what? I smile more.
Yeah.
Even though I'm sore.
Even though you're dying in pain. Yeah. There's a satisfaction though that comes with that.
There is. It releases endorphins. It's just a natural way of being happy.
Yeah.
And it doesn't have to be running marathons. It is walking, as simple as walking. Walking every day. And people think, I'm not going to walk a mile. You'll be surprised. You know, maybe don't walk a mile. Maybe walk a little bit every day around the block and then extend it.
Yeah.
And you can keep doing that. You could say bye to medications.
Yeah.
or most of them at least.
That's true. That's true. Well, that's, again, the truth that you provide. Let's talk about some, I don't want to say be a myth buster here, but part of that exercise and diet is drinking a lot of water. And it seems like this culture today, we got to drink a gallon of water before lunch.
Yeah, and didn't you say we never did that when we were...
Yeah, I grew up as the water hose, and then you got back in the game or whatever.
Yeah, I mean, there's a lot of marketing with water, especially waters that have alkaline in them or something like that. I'm not too concerned with that.
No?
Because all water that goes into your stomach gets neutralized by the acidity of the stomach. So alkaline water might be a myth, okay? That being said, we didn't drink water back in the 70s and 80s as much as we do today, but maybe because new data came around and we should. So I do agree that drinking more water, hydrating oneself is very healthy. You don't have to spend $5 on a bottle of water, though.
Right. No joke. Is the water hose okay?
Yeah, it's fine. It's fine.
That's cool. Hey, we're talking with Dr. Aziz with Apex Medcare in Shavano.
Yeah.
Tell us how to get there.
Yeah, it's down 10 days of Allah towards Shavano Park.
And you got the big ribbon cutting coming up.
Yeah, the ribbon cutting's on March 7th. It's our grand opening.
Wow.
Yeah, we'll have food trucks, raffles, and a health fair.
What time do we show up?
10 a.m.
Okay. And raffle prizes? What do you already know? Any idea what that looks like?
Okay, we passed the Super Bowl, so the big screen TV's off the table.
That's gone.
No.
Right?
No, but it's raffle prizes. We have great tumblers.
Yeah.
We have high-quality tumblers. We have Spurs tickets that we give
Hey.
away. Yeah. So, yeah, we have some fun stuff, and we're still thinking of more fun things to add to the raffle.
All right. Well, we'll need to be there. And again, you can learn more at the website for Apex Medcare, which is?
apexmed.clinic.
Brilliant. Apexmed.clinic is the website. Check it out. You got a lot of great details on there. In fact, you can hear this interview we're doing now on demand in case you missed any of it. And the first note that we did. Also in the house is Dr. Brown.
Yeah, Dr. Brown's in the house. He actually has a nickname.
Oh, yeah?
Yeah, it's called 5-Star Brown.
Is he a general?
No, he just gets 5 stars
all the time.
Customer service. He's such a great physician. He knows how to treat the whole patient. It's just been a pleasure working with him. Okay. I'd highly recommend him.
How did you meet?
We met through colleagues. Yeah. I mean, the physician community is big but small, and we have the same ambitions and the same school of thought, so we gelled well together.
Well, it's good to be equally yoked, being on the same team and helping, and those 5 stars aren't bad to get either.
No, they're not. That's great. We would like more if we can, when we appreciate those.
All right, so Dr. Aziz, our listeners are listening to this conversation. All right, so you like cool music, you give back to the community, you're saying smart things. Me not smart, you smart. I think I want you to be my guy. So where do I start?
I mean, I would start with just the website, apexmed.clinic. We have our own patient portal.
Okay.
Schedule an appointment there, reach out to the team, or feel free to give us a call at 210-892-0224.
Do I need to bring anything when I show up for the first time?
Bring yourself.
That's it?
Once you come in, we have an iPad where you can register yourself.
Yeah.
We would say bring an ID and your insurance card. Yeah.
All right, so here's a hard question. What if I don't have insurance?
Well, if you don't have insurance, we look at the Medicare allowable, and we will bill at 50% of that.
You take care of us all the way around.
Yes, sir.
All right. Anybody else you want to brag on or thank?
I want to thank the whole Apex team. We have a culture of family, and people really do take care of each other within our organization. And because they're happy and they care for each other, they care for our patients.
Yes.
And it trickles down. And I think when people come to our clinic, they feel it.
Yeah.
Yeah. That makes me happy.
I can see the pride inside you.
Yeah.
It makes you feel good. ApexMed.clinic, again, is the website. You're on Days of Allah Road. Tell us exactly, when I make that turn on Days of Allah, what am I looking for?
You keep going down until you reach Indian Woods Business Park, and
right.
Apex Med is right there. You'll see the sign, Apex Med.
Perfect.
Primary Care Shavano.
Cool. Kids doing all right?
Yeah, they're great. Actually, there's some turmoil in the house.
Uh-oh.
Yeah. So I have 2 kids at UT, and I have a kid that looks like he's getting accepted at A&M. Yeah, we don't know what to do.
Well, you'll be all right.
Yeah, I'll be all right.
Your future's set. You're taking care of your kids. You got smart kids.
They're average.
Yeah, sure.
Yeah, they work hard though, which it makes me more proud.
Yeah,
that they don't give up.
Okay.
And they're all we'll see what the third one wants to be, but the first 2 are are studying medicine
Okay.
right now. Yeah.
So in the fall, when the Aggies play the Longhorns, what shirt you wearing?
I'll just stand there on the 50-yard line.
That's right.
Yeah, and I'll wear a half and half shirt.
That's awesome. Dr. Aziz, you're amazing. It is apexmed.clinic, the website. Just keep up the great work, and congratulations on the grand opening.
Thank you, sir. I really appreciate you.
And thank you for listening to Boerne Radio, 103.9 FM. Go Apex!
Go Apex.